Hi, thank you for tuning in. I'm Dr. Jacqueline DuPont, a gerontologist, and I'm here to talk today about expectations when moving your loved one into an assisted living, or otherwise called a residential care facility for the elderly, or group home, or boarding care, or large assisted living. Sometimes they're called hotels, senior hotels, which they're not, and sometimes they're called cruise ships. But either way, an assisted living in the proper term, in California at least, is an RCFE, Residential Care Facility for the Elderly. And they really are wonderful places that are non-medical, yet beautiful and social. However, they do provide some medical services. So if that doesn't confuse you, I don't know what will. Non-medical, but provide medical services. So what are the medical services that they actually provide? Well, usually they contract with an in-house physician, and that physician can be a geriatrician by skill, training, or license. And then they'll usually have a psychiatrist or neurologist. And a lot of times they may have a third-party HMO doctor as well, because it's very difficult to get HMO residents seen in assisted living. It's very hard to find them, but there are some out there. Otherwise, you do have to go outside to see the doctor. So that's a little bit of the medical care that the physician comes in, either weekly, bi-weekly, monthly, but they come out to see your loved one. Do they come out daily? That's a question, some families ask. No, they don't. This is not skilled nursing where they have a daily physician visiting or weekly. Here we do have weekly, however, many assisted livings don't. And don't forget, we're memory care here. So Vista Gardens is a little different. Irvine Cottages is a little different that way. We have more physician visits. But again, we don't see, for example, the resident on admission with a doctor. That would be a hospital or subacute center. Not even all nursing homes see them the day they're admitted. So there's no admission workup or anything like that. It's definitely a monitoring situation for custodial care. And what is custodial care? Well, that's another conundrum, like, is it medical care or not medical care? Well, I think bathing, for sure. It's not medical, but we're definitely assisting them and observing in the shower. So assistance with bathing is critical, and that's a big help. Another really important point is getting their medications to them. So usually facilities give medications 3, 4, 5 times a day. Insulin, for example, they may charge for that extra, but that's something that would be done in the facility. Weights, we do weigh them, but usually once a month. Some facilities do more, some do less, some don't do it at all. It is common to weigh them once a month. Another requirement that's really critical is special doctor prescribed diets. So I know it's hard to actually spit that one out. They have in California a requirement that if it's diabetic or a special texture to the diet, such as puree or mechanical soft, that all of that be specified under doctor's orders. And the doctor needs to write an order, and then the dietary department or the person preparing the meals gets that. So again, it's not medical, but it is critical that the doctor write an order for that. Physical therapy, home health, wound care, hospice, that's all contracted with agencies in California that have different licenses. They may have a Medicare license, they're under the Department of Health. And they come out and they bill that older adults insurance, whether it's an HMO or Medicare with a supplement. So that's how the medical component works in assisted living. Assisted living, what do? Well, we're doing, again, the medications, the bathing, the grooming, the escorting of the meals. The activities are critical, and that's all you're paying for, is all that wonderful care. However, observation, making sure they're getting to the right place at the right time, and encouragement, and all kinds of activities, like I said, music, art, sometimes even exercise. However, not medical. So physical therapy would be, again, contracted out, and speech therapy would be contracted out, wound care would be contracted out, hospice care, all of that. I just wanted to clarify that because I do get quite a few families that say, well, tell me about your wound care. And I said, well, we don't do the wound care, but we order it through ABC Home Health. And it's a really good home health, and we hope it's a good one. However, you're free to choose whichever home health you choose. And again, that's another point. Don't forget, you always have the right to choose your hospice, your home health, your doctor. Don't let a facility tell you you must use ours. Is it more convenient and will you get better care? You might, because they might have a great relationship with all those vendors and it might seem smoother, but you never know. If you really have a vendor that you really love, go ahead and use them. I'm sure they'll be happy with that. Another point that's often brought up is pharmacy. Do we use the pharmacy that the assisted living is using, or can we use our own? Every company has a different policy. However, it's nice to use the pharmacy they do have. It's usually called a closed door pharmacy, and they're really good at bubble packaging, printing the MARS, the medical record, whether they're printed or using electronic MARS. You find that there's less mistakes. You do have to compliment the med techs for doing all of this work. I mean, packaging, popping out pills, handing them to the resident, making sure there's proper documentation. It's all a lot of work and a lot of training. However, having a consistent pharmacy is critical. But if you want to use your own pharmacy due to cost, and that could be, thousands of dollars of savings, I'm sure the facility will have the empathy to, say, hey, it's okay. We can go to the extra time to pill count or pop out pills from the vial instead. They should be understanding about that. Ask the director and hopefully they can accommodate you. But pharmacy is a big deal and it is contracted out. Again, it's not owned usually by the facility. And if it is, they should let you know that they own the pharmacy. So those are a few of the services that are contracted out: home health, speech, occupational and physical therapy, pharmacy, medical doctor, and medical doctor visits. All of that is through Medicare Part A and B. So I hope that's clarified the issue of who provides the medical care and who doesn't. If you have any questions, though, feel free to talk to that director or email me as well. I'd be happy to explain it a little better. But have a wonderful, wonderful holiday, and thank you for tuning in.